Patient advocacy is a big topic, an important topic here in Rome at the meeting on blood cancer in the elderly. Professor Hasford from Ludwig-Maximilians-Universität in Munich, you're a specialist on this because you've been looking at things like equal access, and you've discovered that older people don't necessarily get full access to some cancer treatments.
Yes, that's true, and that was quite a surprise for us. I'm working particularly in chronic myeloid leukemia, which is a disease that's primarily occurring in elderly patients. And since a couple of years, there is a very good new treatment with remarkable success. So it made sense to check whether all patients get equal access to this treatment. And the surprising finding for us was that they don't. In particular, elderly patients, and this starts already at the age of 50, get less and less likely the new treatment.
So even in a disease like chronic myeloid leukemia, where imatinib and its sister drugs have brought in a completely new era in terms of survival, even then you're finding that there's discrimination against older people?
Yes. There's very little doubt. The database we accessed is representative for a population of about 10 million people. And there are about 1,000 CML patients in it. And there's no doubt the older you are, the less access you get to modern state-of-the-art treatments.
And from your epidemiological studies, have you been able to show what in fact might be causing that age discrimination?
This is very difficult as we used databases of insurances, and thus they do not allow us to answer the why question. Why does it happen? There is certainly one reason which I realized in discussing the results with physicians. When you read newspapers about life expectancy, you always read, for example, a male in Germany has a median life expectancy of 76 years. But what many physicians do not know is that the life expectancy is calculated on a condition which age you have already achieved. So once you are born, it's 76 years. But when you are 60 years, that means you have achieved to the 60th birthday, there are for males another 20 years and for women another 24 years. And if you have achieved to become 70, there's for males another 13 years. And this seems to be not known by many physicians, that it makes a lot of sense to give an elderly patient, for example, with 70, a very modern drug which allows for a life expectancy, let's say, for another 10 or 15 years, as this is the normal life expectancy of these patients.
Do you think that it's only in chronic myeloid leukemia, or what about other cancers? Do you think the same thing is happening?
I don't have empirical data about that, but one has also to keep in mind that not in all hematological cancers there are such progress available with regard to treatment. So it might not be that relevant to have access to the most modern treatments, in particular if they are, let's say, also more pronounced on the toxic side. But with regard to chronic myeloid leukemia, the tyrosine kinase inhibitors are fairly well tolerated even by elderly patients, but at the same time they provide, as you've said already, considerable progress with regard to survival time. And we have also done analysis with regard to prognosis of the disease. And with the tyrosine kinase inhibitors, age is not anymore a prognostic factor.
That's amazing. And clearly there are treatments for older patients. What do you think doctors should be doing about this?
In general, I think age should not be a decisive factor in selecting a treatment. You should always look at the patient and his biological state and not on the age status. If the patient is fit and has not a lot of serious comorbidity, he or she should always receive the current state-of-the-art treatment. That's my definite opinion.
Professor Joerg Hasford, thank you very much indeed.
You're welcome.